This patient presented with trauma, and unfortunately, the baby did not survive, and the cause of death was determined to be placental abruption, leading to loss of blood supply to the baby, and the baby did not make it. We do not routinely encounter these cases, so there are a lot of learning points that can help us determine the placental abruption on a CT. CT is not a very good modality for evaluating placental abruption, but when a patient comes in for trauma, this is the first investigation of choice. And if we can identify features of placental abruption on a CT with confidence, that can help in management. For example, if the baby was older, in low 30 weeks of gestation, they could have induced a delivery and saved the baby if there were placental abruption detected with patients with the baby still showing heartbeat. Unfortunately, in this case, however, when the patient was received by us, the baby had already passed. So we will look at the CT findings here. So as you can see, this is a Sag image. We can see the placenta here is along the posterior wall of the uterus, and the baby is squished anteriorly because of the mass effect from the placenta. Usually placenta is not this big, so this heterogeneous dense thickening of the placenta causing increase in the size of the placenta is a sign that there is probably bleed within the placenta. Other findings are better seen on the axial images. So on the axial images here we can see the heterogeneous thickening of the placenta that we can see here. And as I said, CT is not the best modality of choice for evaluating placental abruption. MRI is ideal, but more often than not, when the patient presents with acute trauma, CT is the first investigation of choice that is performed. So we are scrolling up here. I've switched to liver windows to demonstrate better contrast of the soft tissues in the blood. So upper margin of the placenta here can be seen, and anteriorly you can see there this hyperdense areas. These are all hematomas within the placenta, and going down here, that again is a hyperdensity that is consistent with hematoma within the placenta. This is the heterogeneous normal placenta that we see. And as we scroll up here, we can see there is contrast extravasation along the margin of the placenta. This hyperdense structure is the IV contrast that is extravasating, suggestive of active bleeding along the placental margin. On the contralateral side also, you can see there's this contrast that is layering along the placental margin. In fact, between the placental margin and the wall of the uterus, consistent with active bleeding at the time of the acquisition of the scan. These tubular structures that we see with IV, with lighting up with contrast, are consistent with blood vessels, and blood vessels are normal to be seen in placenta. What is not normal is pooling of blood vessels. So if we come down here, there is this pooling of blood here, which is layering, and I'll change the window a little bit. And there is pooling of blood here in this pocket here, another area of pooling of blood. And there we can see this hypodense area. So this is consistent with active bleeding within the placental tissue, and this hypodensity is likely a separated placenta or edema. Again, slight hypodensity. This is abnormal, round hypodensity within the placental plane. And if you alter the window a little bit more, we can see there's a thin line right behind the placenta and between the placental wall and the posterior wall of the uterus. This thin line is present, which is not normally seen. This likely represents edema or separation of the placenta that is consistent with placental abruption. We'll look at the same findings on the Sag images to better understand. So here we can see this is a baby anteriorly that is squished secondary to the mass effect from the placenta, and placenta is extremely thickened. It's almost occupying half of the uterus volume, and there are these hyperdense areas consistent with blood in them. These round pockets of hypodensity here likely represent areas of placental abruption. There is pooling of blood that we saw on the axial plane much better. Like and then there's this pooling of blood here with contrast extravasation. And in the top part of the placenta here, we see there's this pooling of the blood between the interface of the placenta and the posterior wall of the uterus, consistent with active bleeding within the placenta. So this was a case of placental abruption detected on CT. We don't see that very commonly, but if we do see them and the baby is greater than 30 weeks old, there are chances of sort of saving the baby by inducing or by operating and taking the baby out. But if the baby is too young to survive, the baby usually does not make it. So early detection of placental abruption is important in late second trimester and can have a critical role in saving baby's life. And in this particular case, however, the patient's since the baby had already died by the time the patient presented to us, the patient's coagulation markers were getting deranged and the patient was going towards DIC. And in this patient, the dead baby was delivered, induced, and after the baby was delivered, the patient's coagulation markers went back to normal. So in any event, it's important to identify early on placental abruption on CT. Thank you.